This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio, bringing you a very interesting piece of information today on a condition that affects way too many people. If you've had other problems and you've tried, you've applied, there's interesting ways of finding out more about those things. How do you do that? You get a hold of us. You call us, 703-698-7117. That's 703-698-7117. Or go to rosellecare.com. That's ROSELLECARE.com. And send us a note. I promise you we will respond. And if you want somebody to talk to you, call that number and somebody will get back to you and they'll talk to you specifically about your situation. But today's show is about a condition, again, that affects way too many people. And in studio to help me discuss it, which will be your host this Wednesday evening, the 12th of November at 7:30 p.m., Dr. Matthew Adams. We're going to talk about thyroid problems and thyroid dysfunction. Dr. Matt, welcome again.
Thank you very much for having me.
Yeah, well, listen, it's always fun to, put you on the hot spot and make sure that everybody understands that you're an expert in many things. But this particular situation, I know that you have an affinity for. We treat way too much of it in the office. And often it's a secondary manifestation of other conditions. And we're going to weed our way through that today, and I want to talk to you about how that works. But first, let's talk about something very simple. What is the job of the thyroid?
The thyroid has a big job. It's a small piece in our body that has a big job. I think the biggest thing is how much it regulates metabolism and how our body works. That's why people with thyroid problems have trouble, with energy. They have trouble staying warm. They have trouble getting oxygen. They're dry skin, maybe constipation. So the thyroid affects so much in the body. Hormone control. I mean, it's you name it in the body. There's a receptor to thyroid hormone there. So it's extremely important.
That's the truth of it. That in every cell in the body, every organ system, every tissue has a receptor site for a thyroid hormone. And, you see patients that are coming in and they're on thyroid this and they're on thyroid that and so forth. But the problem is that most of these patients are either, one, misdiagnosed, or they're on the wrong medication, or they shouldn't be on medication at all because there's other ways of solving this problem. And that's what I want to talk about today is what are the real presentations initially. Somebody walks in and sees you. The thyroid, as we've said, this little gland that sits at your throat and it controls all kinds of things. I want to make a comment before we get into the specificities of this. When people think of the thyroid, they forget about another little organ that's embedded in the 4 lobes of the thyroid, and it's called the parathyroid. And these little glands control calcium metabolism. So when the thyroid doesn't work, calcium metabolism is also off. And I'm setting that up for a reason, because we're going to talk about that in a second. Yeah. So, Dr. Matt, let's talk about the role of the thyroid is that it helps virtually every tissue in your body. But how do you know when a patient comes in, they're complaining of pain, I don't feel good, I don't have the energy, I can't think through things, I can't get my weight off, my periods are bad, and guys sometimes erectile dysfunction and so forth. How do you know? What is your first suspicion that we have a thyroid problem?
Well, your first suspicion? I think the first suspicion has to do with trying to, now you're getting into hypo or hyper, but hypothyroid, which is the predominant presentation of thyroid problems, you're losing hair, the outside part of your eyebrows, you're starting to lose hair there. The patient is complaining of being cold all the time. I mean, those are the biggest ones. And then you follow it with simple blood work. And I think it's very simple. And unfortunately, the medical community is not taking advantage of that. They don't test all the different things that are needed in order to properly diagnose the thyroid issues. And people get misdiagnosed and forgotten and given antidepressants and things like that.
Well, people come in, to the office and they say, "Here's my blood work." First time in, the patient says, "Here, I brought this with me," and I look at their blood work, and as you do, and they have TSH, which is thyroid stimulating hormone, and maybe they ordered T4.
Yeah, maybe T4.
And T4 is thyroxine, and it's the primary hormone that the thyroid makes. But that's just the beginning of the story. The TSH level has huge parameters relative to most laboratories. They go as low as 0.578 up to 4.5. The thing with it is that there's a functional medicine normal, the level that the thyroid works optimally, and that's 1.8 to 2.3.
Yeah.
So if it's not within that, we begin to be suspicious that there's a problem someplace. But again, what are the other markers? There's other markers that are associated with thyroid dysfunction.
Well, yeah, you have to look at, TSH for one, the interesting thing there is it's actually coming from another gland called the pituitary gland. So it's not even a measure of what the thyroid is producing, and I think that gets misleading. T4 is the one the thyroid produces, but T4 really, the body is not able to really use the T4 that much. The highest availability, or not availability, but the highest ability or hormone the body can use is something called T3, and your body has to convert the T4 into T3.
Where?
Liver. Predominantly. You can go to target tissues in different parts of the body, but predominantly the liver is where you're going to have the conversion into T3. And unfortunately, that gets missed. And if your T3 is off, but your other normal hormones like TSH and T4 are all in the normal range, then they send you off. Your thyroid's fine. I don't know what's wrong with you. Take this medication and we'll see what happens.
Well, it blows me away. After 38 years of practice, I see this on an ongoing basis, almost daily, unfortunately. And people come in and they have a TSH level that is, somewhat within the laboratory range. Their T4 level is within the laboratory normals. I'm not sure why these guys don't look if something's normal low or normal too high. They don't skew things, but then 80% of your T4 has to be converted to T3.
Yep.
But that's not the end of the story. Now you've got something called free T3, T3 uptake, reverse T3.
Because we got to know what the T3 is doing. We got to know if the T3 is being absorbed. We got to know if we're making T3 that's not really bioavailable. That's nothing in the story. So even if they just do a T3, that's great. I'm glad that they're running that one at least. But then it doesn't really tell us, well, now what's happening to that hormone? What's it doing? Is the body able to use it? Then you have to ask more questions. Yeah,
if it's getting into the receptor sites at all. So, you have all these things. You have things like TPO with thyroid antibodies, and you have some other measures as well. And then there's this thing that we're not going to talk about it too much today, but I know you are in the program. That's called HPA axis, hypothalamus pituitary adrenal, which is one of the initiators, the kickers into thyroid function. It's so often missed. You go in, I talk about, prescription arthritis. These guys come in and all they do is say, here, take this and we'll see how it works out. Well, if you take the time and figure it out to begin with, you get it straight up. In a thyroid presentation, you talked about the, loss of hair, the thinning of hair. It happens, not all the time, but frequently enough.
Can't lose weight. That's a huge one.
You can't get the weight off. Also, you're cold all the time.
Yeah.
And when you have a thyroid problem, you watch television and you cry at the commercials. You become very emotional, and it's almost always thyroid. You sit there and you look at the commercial, and it's a really cute commercial, it's a really sad commercial, or something in between, and you start tearing up. That's thyroid. And sometimes I'll sit there with Sue because Sue's thyroid at one point was bouncing, and she'll look at something and she gets really excited about it and she'll cry a little bit, and I'll say, thyroid, we got to fix that again, right? But that's, if she's listening to this, I am in so much trouble, you have no idea. But the point of it is that, and then the heels crack and the elbows are dry and, hair breaks off the body and so forth. All of those are thyroid conditions, and they go on. Body pain generally across the board. So you have a patient that comes in, and generally, patients don't come in, they come in because they're tired. They come in because they're fatigued. They come in with a combination of those things. They can't think. It's like they're brain dead is what they'll tell you that happens. Or their body just hurts generally. It aches generally.
Yeah.
That is a flag that says, you may have a thyroid problem. Doesn't tell you where it's coming from, but it tells you the thyroid's involved. Why?
Tells you the thyroid's involved. Why? Well, because, like we said, the thyroid controls every area of the body. And then you have to look at, okay, so if there's a thyroid problem, let's say we find out our T3's off, our T4's off finally after we run the right blood tests. Then you have to ask, well, why is that? And then you go into other issues. But going into the joints and the aching, we talked about that. You already mentioned the parathyroid. You mentioned calcium. What are your bones made of? They're made of calcium. Yeah. What we use to contract muscle? We have calcium channels to help with muscle contraction. Calcium's huge. And so if your parathyroid, which is the area we're used to absorb and use calcium, is off because of the thyroid being off, then you're in trouble right there. That explains a lot of the pain and problems.
This Wednesday evening, November the 12th, 7:30 p.m., Dr. Matt Adams will be your host, your presenter, at the Roselle Center for Healing in Fairfax. We're located about a third of a mile off the Capitol Beltway at the Red Cross building on the corner of 50 and Prosperity. Join us. These public service classes that we offer are called our in-house continuing education programs. They're no charge to you. They're our gift to you because we want to educate you so you can take care of yourself, particularly in the light of health care and the way it's delivered and administered today, particularly in light of the Affordable Care Act. You are going to know more if you come to these classes than your doctors know, and you're going to be able to ask the right questions. But this Wednesday evening, the 12th, 7:30 p.m., please be our guest. Call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. We don't require anything except for a reservation, but we need a reservation so we know how many people to plan for. Dr. Matt, when you go into the class this Wednesday evening, I know you're going to talk about different aspects, but what I want to tap on you right now is the process of identification. Again, I know I'm beating that up a little bit, but it's critical because so many people get bypassed. Years ago, we used to do temperatures, or first morning temperatures under the armpit with the old mercury thermometers, and we used to take iodine and rub it into the skin and watch the absorption level. If it absorbed really, really quickly, we know that there was probably a thyroid problem and an iodine deficiency. But today there's many other things. You're talking about the blood work. So when you have a patient, what are you going to want? What do you really need to have in front of you to make a definitive diagnosis as a primary thyroid problem?
Well, again, we're going to run, TSH, T4, T3, free T4, free T3, T3 uptake. May have missed one right there. And then the other thing we want to look at, because if someone's presenting with hypothyroid, which is the most common thyroid issue, we're going to look at antibodies to thyroid. Antibodies are cells that your body makes to attack your own tissues, which we need a small amount to get rid of, use up tissue, old tissue. But if we make too much, then we start to attack and destroy our own cells. And 90% of the people who have hypothyroid in the United States have something called Hashimoto's. And so we need to measure the antibodies to the thyroid to find out if it's under attack, and maybe that's why the thyroid hormone numbers are off.
Hashimoto's thyroiditis is growing by leaps and bounds.
Huge.
And the literature points out, and the clinical representations today are saying that about 60% of all hypothyroid patients are actually Hashimoto's thyroiditis patients.
Is that the world, or is that
in this country?
In this country, I feel like it's higher than 60%.
It could be. I mean, in our practice it is, but I'm just giving you the data that's there. Dr. Matt, we're coming up to a break, and I want to get into Hashimoto's thyroiditis. I want to get into Graves' a little bit, and anybody that's listening to us that has that type of problem knows that these are very serious conditions, and they can destroy somebody's life because it can cause heart problems and so forth. You're listening to Dr. Tom Roselle Live, and Dr. Matthew Adams, my guest, your presenter this Wednesday evening. Don't go away. We'll be right back after these important messages.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. In studio, have a very special guest, and your presenter this Wednesday evening, Dr. Matthew Adams. What is he going to talk about? Thyroid problems. If you're on thyroid medications, you've been told that you got a thyroid dysfunction problem, listen. The majority of cases don't have to stay on medication forever. There's a way of reversing, unless you don't have a thyroid or your thyroid has been duped into thinking that it needs the hormone, meaning that you're taking way too much of it. It's the old situation. If you don't use it, you lose it. And the body's just like that. Every organ in the body is like that. If it shuts down, pretty soon it's very difficult to get it started again. But in the majority of cases, things can be switched and they can be reversed. Dr. Matt.
Yep.
This Wednesday, the 12th.
7:30
p.m.
Have some fun.
You're going to be opening the light, taking the veil off, so to speak, so people can really understand what they can do with this thing without drugs. There's so many different ways of treating thyroid dysfunction, but you start with understanding what it is. I want to get into some of this in the second half, but right now we left before the break and we were starting to talk about Hashimoto's thyroiditis. Take us through that. What is the difference between a simple hypothyroid problem and a Hashimoto's thyroiditis, which we said that is affecting way too many people today?
Okay, simple hypothyroid problem. We say simple, but I don't know how simple it is. There's hypothyroid. You have to figure out why the hormone is not, the receptors are not working. You have to figure out why the thyroid is a little sluggish, where the communication is missing, maybe some vitamin deficiencies, things like that. So on a simple hypothyroid, everything is working. We just have to support it to make it more efficient, find the blockages, in a sense, and help them to work better. Hashimoto's thyroiditis, which leads to hypothyroid, is an autoimmune. And autoimmune is a self-attacking, it's when your body's attacking itself, basically. So it's an immune problem. Hashimoto's is not necessarily a thyroid problem. It does affect the thyroid, but it's an immune problem where your immune system is overreactive. So that would be the major difference there.
You get a Hashimoto's thyroiditis and you get a hypothyroid patient, and literally the symptomological representation, the presentation is very similar.
Well, yeah, because it's attacking the thyroid. So, thyroid's not working very well because it's constantly under attack by your own immune system.
So here's the question that I have for you. Is a Hashimoto's thyroiditis an immune function problem in the sense that it's destroying the thyroid, or is it one that is causing first an inflammatory barrier or an inflammatory blockage of the thyroid?
I believe the answer is yes.
That's right. Exactly right. Thank you very much. See, there's certain traps on this program, and we want to test our presenters just to see if they know what they're talking about.
Thank you. I'm glad I passed that one.
And you did pass the test. Yes, they are exactly the same. It will destroy the gland over a period of time, and actually initially will cause the gland to be very swollen, and then it begins to degrade. It begins to shrink down, and to the place where it's not existent anymore. But along the pathway, everything begins to suffer. The things that you also see with Hashimoto's thyroiditis is you begin to see the heart involvement. You begin to see rapid heartbeats. The heart flares and then it comes back down to normal. You end up seeing all kinds of other autoimmune reactions associated with it. But there's a clue here with these patients that we're seeing. We talked about earlier that there's way too many. I said 60% because that's within the literature, but in our office, anecdotally, it's probably far more than that.
Yes.
But so what's your opinion? Why?
Well, my opinion is a lot of it has to do with the things that we're exposed to, the lifestyle choices that we make. For instance, any autoimmune disease really is triggered by other things that have taken place that cause your immune system to become hyperreactive. With Hashimoto's thyroiditis, some of the top ones have to do with Lyme disease or infections in the gut. You've got metal in the body that's causing reactions. You've got vitamin D deficiencies. And you have other stressors that have taken place, like emotional stressors that have been very traumatic, or injuries, or you've had even things like pregnancy, things like that can cause this autoimmune to kick in and jumpstart and go and cause all these problems.
Hold that thought, my friend. We're coming up to a break, and we have to listen to some very important information and people that bring you Dr. Tom Roselle Live. When we come back, we're going to talk about polyglandular 1 and polyglandular 2 as it relates to Hashimoto's thyroiditis. Don't go away. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle Live on WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio with a very special guest, Dr. Matthew Adams. He will be your host this Wednesday evening, the 12th of November at 7:30 p.m. He's going to be talking about thyroid problems, thyroid deficiencies, hypothyroidism. He'll distinguish the difference between Hashimoto's and Graves' and other types of problems. If you have been diagnosed or have been told that you have a thyroid problem or think that you have a thyroid problem or you have a family that it seems to run through your household with thyroid problems, this is an opportunity really to shed some light on it, to find out what you can do and make a difference in your own life. Give us a call at 703-698-7117. That's 703-698-7117. And just be there. I mean, this is a class, is our gift to you. This is a freebie. This is one where we try to give as much information to you as we possibly can. And why do we do that? Because we want to educate you. Because we truly believe that you need to be the captain of your own ship. You know, that's why I wrote my book, a couple years ago, Ageless Health, Health is a Do-It-Yourself program, because I truly believe that your health is directed by what you do and what you don't do. You have an opportunity. You have a choice. This is how you find out how to fix it, okay? So if you have any kind of problems, you're on thyroid medication, this class is a not-to-miss class. Call us, 703-698-7117. That's 703-698-7117. Be there and find out what you can really do to help yourself. Dr. Matt, before we broke for some information and news and so forth, I threw a kind of a snowball at you, and I said we were going to talk about polyglandular 1 and polyglandular 2 when it came to thyroid problems. And everybody's sitting down there saying, what's that? My doctor never told me about polyglandular anything. What does that mean?
Yeah, we just break it down. Poly meaning many, glandular meaning glands or parts of the body. So polyglandular, basically in layman terms, it means that an autoimmune immune system reaction is going to be in multiple places, not just against the thyroid. So multiple systems are affected at the same time. So you can't just, take your magnifying glass, look at the thyroid and say, I'm going to work on the thyroid, I'm going to work on this autoimmune right here in the thyroid, because it's other places and you have to fix all the other things at the same time. Otherwise, your thyroid's going to keep getting hit from other areas that you're not looking at.
That's exactly what takes place, and unfortunately, that's how we look at it, fortunately, but unfortunately, the traditional medical community doesn't. They don't answer those questions. And it still goes back to structural, chemical, emotional. The only three things that can cause anything, biochemical imbalances or exposures, if you will, structural, neurological irritation from injuries that have stood the test of time. People who are in chronic pain are going to have thyroid problems over a period of time because it affects the fight-flight system, it affects the adrenal system, and people who are stressed out, who are constantly internalizing or can't get out of a bad situation, they're ultimately going to have autoimmune reactions that one of the first targets in the body is the thyroid gland. And, whether a patient is on Synthroid or levothyroxine or Nature-Throid or any of these things, or you try to self-treat with iodine and tyrosine and trace minerals, the point of it is that the body was designed to be functionally in a state of equilibrium all the time, except we screw it up. We mess it up as time goes on because of our choices, sometimes lack thereof. So when we're talking about this polysystemic glandular dysfunction, as it relates to thyroid, as you said, it's a multi-system problem. Let's talk about the thyroid issue as it relates to some of the whys behind this. Okay. One of the things that we see today is absolute dietary inadequacies and insufficiencies, particularly in the Western cultures.
Yes, we eat stuff that causes our bodies to get way inflamed. We like our sugar. We like our processed foods because they're really quick and easy to make. And our brain tends to have all those comfort foods, like stuff I grew up on, in the South.
We won't go there.
Yeah, I won't go there.
No.
But
that's a prescription for self-destruction.
Well, that triggers certain things in your brain, and your memory system kicks in, and you remember those smells. But the problem is, some of those areas like it, but when it gets down to your gut goes, what is this? Yeah, I don't like
that's
this.
When you have to disengage the tongue and the stomach because they're not cooperating with each other.
They can, but sometimes they don't. Once you start getting breakdown in the gut, and you get stuff leaking into your bloodstream, and now your liver has to, process that, and then you got more inflammation going through. Your body has to send all its effort to work with this area, and it gets overwhelmed. And so now your immune system just goes crazy. And this is a very simplified way of saying this, but that's where we start to see the beginnings of these thyroid disorders. And then you have to find out, well, okay, why is the gut having problems? Is there an infection in there? Is the stuff I eat, is it a combination? Am I taking antacids all the time and I can't digest my food? This area, mold, we talked about earlier, mold and fungus is huge in this area. Right now, people are coughing and hacking and allergies because the mold count's way up because it's wet and the leaves are getting all moldy. And so you're going to start seeing more representations of this because the immune system is having to fight that. It's getting overwhelmed. And now these autoimmune, like we said, polyglandular things are starting to pop up.
The interesting thing that you mentioned, mold, is that consistent with thyroid problems, whether they're hyper or hypo, people who have ongoing autoimmune reactions, part of the problem, and some, people will tell you what came first, the chicken or the egg, is fungal problems that are chronic that the people can't get rid of. And the situation is what came first. The thing of it is, in my opinion, is that they're both a result of the body's inability to function optimally because of, and we talked about the exposures and pain patterns and so forth, but here's the catcher, right? In this country, we have such a high level of Hashimoto's thyroiditis, hypothyroidism, thyroid conditions, and other autoimmune reactions, right? So we're going to mention two dirty words. Two really dirty words. Cover your ears. Cover your ears, Dr. Matt.
Oh, okay.
Okay. One.
Can we say this on radio?
Yeah, we can. The FDA won't turn us off.
Okay.
Okay. One is Gmo Foods, and the other ones are gluten.
Yep.
And that seems to be the trigger, the two dirty words that are out there today that people are getting bombarded with and say, well, I got to die of something anyway. Let's talk about that a little bit and how they affect thyroid problems.
Well, gluten in particular, there's so many studies on autoimmune, and particularly with Hashimoto's. Those that have it are gluten sensitive. If you have an autoimmune issue, you have to get off gluten. 100%. If you have Hashimoto's, you have to get off gluten. You can't be gluten-free and then every once in a while you have a little bit here and there because it'll stay in your system for months and it will continue to cause inflammation. And if you want to keep yourself from having these problems, again, you got to stay off gluten because of how it destroys the intestinal lining of the gut. Gmo foods, Gmo foods are the same way. They're still coming out with studies right now they still don't really understand exactly what these genetically modified things are doing to our bodies. Our body has to break down nutrition, and if the nutrition is not the normal form, it doesn't always know what to do with it, causing free radicals and oxidative stress and things like that. So there's so much breakdown that takes place from these. And again, any breakdown, anything that causes the immune system to come under attack, that is going to be a trigger for autoimmune.
Okay, let's break it down because we talked about gluten and we talked about GMO.
Yeah.
And let's talk about what they really are. Okay, GMO really stands for genetically modified foods or organisms, right?
Yeah.
Okay. And the culprit behind the scene, the big guy the big bandit out there is Monsanto and his brethren and spin-off companies. And what they've done is they technically have begun to change the genetic map of these foods to cause them to have their own ability to preserve their longevity by making the plant actually produce things like Roundup So after the plant starts germinating, it produces its own weed killer. It produces its own Roundup, but it gets into your body. They've done studies with GMO, with genetically modified foods, and here's the problem. It stimulates something in your body called junk DNA. It's also known as dormant DNA. So these are genes in your body that can put to sleep, that have been, there for years, you've been passed through, but we also know that things don't get stimulated unless they're stimulated. And so when you do put things like genetically modified foods in your body, what it does is it triggers the activity of these things, right?
You are what you eat.
Absolutely.
So you're made up of what you put in your body. It's the fuel of your body. So, yeah, if you put in stuff that's modified genetically, what's it going to do to your genetics?
So here's a question for you.
Yeah.
We talked about gluten. I said that's the other dirty word.
Okay.
But the argument is going to be, but we've had gluten for centuries. We've had bread, we've had wheat, we've had grains forever. Why aren't they the same?
Well, it depends on where you're getting it from. If you get it from here in the United States, predominantly, I think Monsanto has its hand in the wheat production and other things. So things are genetically modified to produce more gluten, which makes breads more sticky.
Well, gluten is glue.
Well, it is, and that's why you don't. Most other countries you don't get the nice chewy cookies like you get here, because we're able to make a gluey substance to make a real chewy cookie. I know we had a foreign exchange student. She'd go to Brazil, and when she came back up here, she would bring all the cookie doughs back down there to Brazil because they didn't have the same type of things that we had up here to make that. What kind of pastries you get when you're over in Italy?
Good ones.
Yeah. and we even had someone bring in bread from over there in that area. And I recently had a patient who went to Europe with all kinds of digestive problems, and she went to Europe and it felt great. And she came back, and as soon as she got off the plane, she's feeling terrible again. And she realized she's got to make some changes. But a lot of it, well, again, we're going into Monsanto. A lot of other countries don't allow them to produce the foods over there like they do here. And we're getting into more.
Well, we are. And the thing is something that we can get into. But gluten modification is one of those things that there are many different types of gluten, and there's things called ancient grains that are no longer produced. They're stripped of all the good stuff that's in them. And if we could get the same grains that were produced, even a few hundred years ago in Europe, we wouldn't have half the problems. When I grew up, and as my son would say, when dinosaurs ruled the earth and things were at a different stage, the foods were different then. I mean, we grew our own foods and the wheats were different, but you're right when you said that most of our grains have been modified to the point where they have very little sustenance. They've been engineered so they produce far more gluten in the system, and subsequently they cause an intestinal tract reaction. And what I want people to understand is that 80% of the body's immunological system resides in the intestinal tract. 80%. It's huge. And it's causing all the problems that we're seeing because of the garbage that we're putting in our mouth as being one of the primary culprits.
Yeah, so then we destroy the gut lining because the gluten gets through. It's a really hard protein for your digest. It's large. And once it gets in there, it can cause more permeability or larger holes in the intestinal tract, if you will. And then your body goes and attacks that area, and now other things get through. So all the other things that we're exposed to, like we talked about, we're breathing in. There's so many different microorganisms in our food. I won't get into that because people won't want to eat anymore.
I know. We could really ruin everybody's diet for probably the next 2 years if we continue
But your immune system's amazing that it can handle all these things. But if your gut's not doing so well, that stuff's going to get through into your system, and that's not good.
Well, then we end up with something called permeability of the gut, which is a sieve, and we're going exactly what I wanted to talk about, is that permeability means that if you visualize a colander with really, really small holes in it, and there shouldn't be any holes in the intestinal tract. It should be a gate process. When things are fully digested, the gates open up, the receptor sites are locked into these things, the nutrients are drawn into the body, and that's how your body works. But when we have this permeability, this colander with fine sieve-like features, things get in less digested, so the body looks at it as an enemy. So you end up with this inflammatory autoimmune reaction. It says, we have to go to war. So inflammation is acid. Acid causes degradation and deterioration and breakdown of all kinds of tissues. But we have this immune response, and pretty soon we got prostaglandin reactions and so forth that are saying, whoa, I got to fight this off. But it's a constant, nonstop situation that leads to what we're talking about and what you're going to talk about this Wednesday evening. This Wednesday evening, the 12th, November, 7:30 p.m., Dr. Matthew Adams will be your host, your presenter at the Roselle Center for Healing in Fairfax on the subject of thyroid dysfunction. I promise you, if you have a thyroid condition, you'd like to find out how to fix it without drugs, without surgery, this is an opportunity, because why wait to the place where you don't have a choice anymore and it's affecting everything? This is when you have to learn how to do it. Call us, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. I promise you, we're going to give you more information that you thought was possible on this subject. Coming up to a break, don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
105.9 FM and AM 630 WMAL. Dr. Tom Roselle Live continues now on WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, on the same old place on your radio dial. Make sure you tell your friends about the program, and we're here to bring you only the best cutting-edge information in integrative and natural health care, giving you options, giving you the opportunity to choose and not get stuck in the paradigm of, well, you have to take this drug for the rest of your life. Join us this Wednesday, the 12th of the month. Join Dr. Matt Adams as he presents a program on thyroid dysfunction, all different types of thyroid problems, and he'll be there to answer your questions at the end as well. He's noted to stay there until midnight or so if you have to, if you don't want to go home.
Okay, I don't know.
I will tell Corey you will be late that night, Dr. Matt, but give us a call at 703-698-7117, 703-698-7117. Dr. Matt, you have to serve your patients. If it means 1 o'clock in the morning, you got to stay. That's all. No,
are you gonna bring some beds and some things in there?
Hey, listen, mats and towels and we'll fix them up. We got bathrooms.
Okay,
there.
Well, if you provide food, we'll talk.
Synopsis. What are you going to cover?
We're going to cover a lot. I mean, we're going to cover prevention. Talk about what you can do to prevent these things from happening, like we've been talking about. We're going to talk about how to identify if you have a thyroid problem and what it is, and what to look for, what lab tests to look for. So if you're working with somebody, what to ask your doctor, and really know if your doctor knows how to work with it. And then talk about what we can do, in our office and how we work with it to help you get over a thyroid problem if you have it. And then what you can do later to keep from these things happening. And how you can, help your friends, help other people, because there's so many people that have it. And especially, like you mentioned, family things, we're going to talk about if someone in your family has it, you've got to look for it with yourself too. If you've got a sister or mother that's had thyroid issues, most likely you have a genetic disposition to get it.
The area of interest called epigenetics is one that you don't have to have the same problems that everybody else in your family has had, but if you do all the same things and eat the same way and have the same exposures that they have, the chances are that you're going to have the same problem. But with epigenetics, if you change lifestyle, if you change the things that you do, your exposures, your thought process, and how you handle yourself, then those things go into what we talked about earlier, dormant DNA. They're no longer triggerable, or they're much more difficult to trigger. So you can beat these things. It don't have to be a family treasure that you pass on from one generation to the
Family
next.
treasure. I like that.
Isn't
I
that-
don't like that, but I like the term because that's what we think. I get this from my mother. I get this from my father. It doesn't have to be that way. You can be the change in that link and pass other family treasures on to your posterity.
Yeah, it's called good health and well-being and living as long as you want. But, one of the things in our Ageless Health presentation, the PBS TV special, they said Ageless Health is reaching an age, any age in your life, to be able to do what you want to do, when you want to do it, without impairment or compromise. What a beautiful thing. But you have to understand the topic. You have to understand what that really means, and you have to be willing to take control. We'll be back next Sunday, same old time, same old place, 12 noon, with more interesting and provocative information in the world of integrative and natural therapeutics. This is Dr. Tom Roselle. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.